Hello, my name is Daniel Wagner, and my Nursing Intervention Shark Tank idea is to integrate a moisture sensing incontinence detection system for patients in all long-term care nursing facilities and hospitals. The cost of urinary incontinence in the healthcare system is very large. In America in 2020, the estimated cost of urinary incontinence is upward of $82 billion per year. The cost of patients with urinary incontinence is higher than patients without urinary incontinence. One statistic I found is the difference per patient in an outpatient setting is around $7,000 for incontinent patients versus $3,300 for patients without incontinence. Another statistic said that for inpatient costs, it's about $4,000 for those incontinent patients versus $2,000 for continent patients. The patients with incontinence also had longer stays in hospital settings. They average about 1.5 times per admission. They were almost 5 times more likely to have sacral pressure injuries on admittance, and they were twice as likely to have hospital-acquired sacral injuries during their stay. As we know, prolonged exposure to moisture causes the skin to become weak and increases the increase for breakdown and pressure injury. Exposure to urinary incontinence causes the lipid layer of the skin to lose its structure and for the skin to be susceptible to microorganisms to infiltrate and cause infection. The weakening of the lipid layer can then lead to the skin dryness, which causes the skin to become more fragile and susceptible to breakdown. It's a cyclical cycle of excessive moisture leading to the lipid layer to break down, and then the dryness and further injury, increasing the risk of shearing, which is when you slide across the surface and the skin just tears. Okay. And having worked in both long-term nursing facilities, short-term skilled nursing facilities, and in the hospital, as well as in home care, I know that incontinence is a very real thing. It's very labor intensive. Having to do 2-hour skin checks on patients creates a barrier to care by causing sleep disturbances, having to interrupt them on a regular basis so they can't get a good night's sleep. If we can reduce the sleep interruptions by having a sensor in place in their brief or in their incontinence pad underneath them, that would alert us when the patient is wet. We could eliminate or at least lower the amount of times that we have to disturb them while they sleep. So I did a little mock-up. So this is like a brief, and in the brief there would be a little pad sensor. There's a product called the Night Trainer, which is already in existence. I have a picture of it here. This is what the Night Trainer looks like. So with the existing technology, if we could integrate that into the Call-Lite system so that when the pad on the bed, that's a bed, or the brief itself gets wet, it signals the Call-Lite system. So the patient wouldn't have to be alert and oriented if they're in neurological a compromised setting, if they had a stroke, if they had a car accident and had a traumatic brain injury and weren't able to push the Call-Lite themselves. The system would let the staff know that they are wet and they need to be changed. Sure, we need to be doing 2-hour checks visually and potentially repositioning patients, but if we could reduce the amount of interruptions, it's going to decrease the cost of labor in the healthcare setting. It will potentially decrease the amount of products used, because sometimes you end up tearing a brief open because you think it might be wet and then it ends up being dry. So you would reduce the cost in supplies. You would also make it so that the patients could have a better night's sleep and hopefully rest and promote healing. And that's one thing that we want to do, is promote healing. It also will potentially make it so that the patients don't have that reaction of, oh, they're coming in to disturb me again. Like, no one wants to be woken up. Sometimes it can create animosity from the patients to the staff when the patients are feeling like they're getting interrupted all the time. So this system of having the night trainer or similar moisture sensing device in the brief or in the pad of the bed to alert the call light system saying this patient is wet, and that way the staff can prioritize other needs and take care of the patients when they're wet in real time. You wouldn't have to wait, until the next round to discover that they're wet. You'll get the call light notice and say, hey, this patient is wet, it's time to go change them. And I think that would be a great reduction of labor costs and create better patient experiences and reduce, the nursing burnout and CNA burnout. Because, if all you're doing is doing rounds and changing diapers, it can feel kind of demoralizing. So this would take some of that burden off of the caregivers as well. All right, thank you for your time.